name is Faith Olaiton. I'm going to be your tutor for PHA 302 Phamacodynamics and Chemotherapy II. As a mode of introduction, I would like to implore you that you should kindly take your studies seriously. Do not joke with any part of your assessment, both the test, the assignment, the classworks, even lectures. Make sure you attend and be attentive. It is imperative for you to come out in flying colors in this course, but you have to help yourself. I'm also here to help you. If you have any questions concerning any slide, please be free to mail me, send me a message on my portal, DM me. I'm open to any consultation. And please be specific concerning the slide number, the slide title, so that I'll be able to easily reference your questions. Thank you very much. Pharmacodynamics in relation to chemotherapy. It refers to the study of how chemotherapy drugs interact with the body cells and tissues to produce their therapeutic effect. You have to understand the mechanism by which this drug targets and kills cancer cells, as well as any potential side effects they might cause. Pharmacodynamics provide a foundation for understanding how drug works, to select the appropriate drug and dosage, to monitor the drug response, to identify potential drug interaction, and to develop new drugs. I will be going right now to the next slide, and the slides that are following are specifically talking of different types of drugs that are used, in which you'll be giving to your patient, be administering to your patient. The first one are gastrointestinal drugs. They are drugs that are used to treat infections, diseases that affect the gastric region, the intestinal region. That's your stomach, the colon, and all that. The first group we have here are the antacids that are used to neutralize stomach acid by reacting with the hydrochloric acid to form less irritating salts. We have the proton pump inhibitors that inhibits the final step in acid secretion. We have the motility agents that increase the motility or movement of the gastrointestinal tract, helping food to move through the digestive tract more efficiently. The next group are the renal drugs. They are medications that are specifically designed to treat or manage various conditions that are related to the kidneys. These conditions can range from acute kidney injury to chronic kidney diseases. I'm sure you know the difference between acute and chronic. Okay, so these renal drugs can be used to treat infections, diseases that are related to the kidney generally. They can be used as diuretics, angiotensin converting enzyme inhibitors, angiotensin 2 receptor blockers, phosphate binders, erythropoietin stimulating agents, vitamin D analogs. Side effects, contraindications, side effects such as dizziness. A pregnant or a breastfeeding patient is discouraged not to take it. Severe kidney disease can result from using those drugs, and they have specific allergies. The other group we can talk about are the special sensitive drugs. They target organs responsible for our senses. We know we have 5 senses, so they target those drugs. We have the ophthalmic drugs, otologic drugs, rhinologic drugs, and we have drugs in the ophthalmic section, and the anti-glaucoma, antibiotics, antihistamines, otologic drugs, antihistamines, diuretics, antibiotics. Rhinology, we have decongestants, antihistamines, corticosteroids, and many others. We have the musculoskeletal drugs. These are drugs that are used to treat conditions such as pain, inflammation, muscle spasm, joint stiffness that affects the muscle, bones, and joints. They can be used for pain relief, inflammation reduction. And they have side effects also, gastrointestinal issues, liver or kidney problems. Contraindications can be allergies, existing medical conditions like heart disease. So that means you don't have to take those drugs without informing your doctor of your condition and the underlying condition. So when you are administering these drugs to your patients, you need to ask them some questions concerning their health so that you would not propound their problem. You have the nervous system drugs that work with the central nervous system or the peripheral nervous system to treat various conditions. These conditions can be mood, thought processes, sensation, movement, and you can use them as antidepressants, antipsychotic, anticonvulsants, stimulants, and all of that. They also have some side effects such as sexual dysfunction, dizziness, drowsiness. We have drugs that are for reproduction. They are designed to influence contraception, fertility treatment, hormone replacement, or to address specific reproductive conditions. They also have side effects such as headache, breast tenderness, weight gain, mood changes, irregular bleeding. We have drugs for skin diseases. Most times it can be topical, but it can be systemic. Topical means you apply them to your skin directly, or systemic. Example of topical steroids, we have it. They are used for eczema, psoriasis, allergic dermatitis, and all that. Topical antibiotics, they are used for bacterial infection like impetigo, folliculitis, cellulitis. Topical antifungals, fungal infections like atlas foot, ringworm, and so forth. You have the endocrine drugs. They are used to treat a variety of conditions related to the hormone imbalances, such as diabetes mellitus, thyroid disorder, adrenal disorder, growth hormone deficiency, reproductive disorder, cancers. They also have their own side effects: weight gain, mood changes, heart problems. Cancer drugs, they are majorly called chemotherapeutic agents, but all drugs are chemotherapeutic agents anyway. They also have their side effects: bone marrow suppression, infertility, hair loss. Many people don't want to use it just because of the side effects. We also have anti-infectives. They can be antibiotics, antiviral, antifungal, antiparasitic. Antibiotics work for bacterial infections, antiviral are against viruses, antifungal are against fungal infections, and we have the antiparasitic that are against parasites. We also have antidiabetics, drugs such as metformin, glycosides, glipsides, and all that. Their mechanism of action is to decrease gluconeogenesis and increase insulin sensitivity. It encourages weight loss and causes hypoglycemia. It also have some side effects that we'll be going into details later. We also have hypertensives. They are generally used to reduce hypertension, to make sure we maintain the blood pressure in the patient. We have a lot. We have beta blockers, we have AC inhibitors, renal inhibitors, diuretics, but caution, you have to take these drugs with caution. You don't administer drugs to your patients without asking them some salient questions. In conclusion, nurses play a crucial role in safe and effective administration of medications. They are responsible for ensuring that drugs are given to the correct patient, in the correct dose, via the correct route, and at the correct time. You can see the stress on correct. You have to give the correct patient, no mistake. You have to give the correct dose. It has to pass through the correct route, maybe oral, IV, IM, and at the correct time. Because drug have its half-life, so you have to know what you are doing. For a seamless administration of drugs, every nurse must understand the uniqueness of each drug alongside the benefits each has over another in the same class. We are going to be ending the class right now, but we'll meet again where we'll put this class into so much detail. This is just an introductory part. I wish you all the best, and we'll meet